the barriers to accessing primary care?
Okay, so I think there are several stages of barriers that can be associated in healthcare, and I think the first one is identification of health problems. I think some people do not necessarily have the health education to understand the key symptoms of diseases, and might need help with that. I then think kind of accessing the healthcare itself is another issue. For some people, they might not necessarily understand registration for a GP, particularly migrants that might necessarily not have documentation that they think is required for the GP, but GP services are here for all within the NHS and might need help identifying their local GP practice. For those that are with language barriers that might need, again, help with the forms, and the NHS will offer help with interpretation and translation for access to that healthcare. And then I also think kind of the element of discharging or kind of the outside home environment from healthcare can become a barrier for some people who don't necessarily have a home to go back to that is warm, that has the food available to encourage their recovery. Often that can exacerbate their conditions and means that it's not safe for them to be discharged from their healthcare and making conditions worse and worse.
What is your understanding of the role of administrative staff in the NHS?
Administrative staff are really important in the NHS. They make sure that the whole system is running efficiently and there's really good communication between patients and the healthcare providers itself. One of the main areas of administration is the patient-facing role. So we have the receptionists at the GP practice, which help organise consultations and can help rearrangements. There's also things like the NHS 111, where if there are queries around what's the best area of healthcare, whether that's primary healthcare, to book a GP appointment, whether to go into an A&E or whether to go into a walk-in centre, I think those sorts of administrative staff are really, really important. And then I think there's also the background kind of staff that really hold the NHS together, and examples of those can be bed allocators and ward managers, where they can make sure that the influx of patients in and out is really well controlled to maximise efficiency. And I think without them, the NHS would not be as successful as it is today. So I think overall, administrative staff are really important, whether that be face-to-face or running in the background.
Social media has enabled healthcare staff to speak about medicine and the NHS. What are the advantages and disadvantages of this?
I think, in this new age of social media, it's really helped healthcare, I'd say. I think two of the main positives we can take away is education. Social media is really prevalent in the younger generation who don't necessarily have the same healthcare education as older people. And I think it's really helped maybe demystify certain things. A really good example from my own life is when the COVID vaccine was coming out. I think there was lots of rumours and false information being spread around the dangers of the COVID vaccines and where they've all come from. And I think, healthcare practitioners and maybe even medical students educating online, it's a really quick, free, easy way to spread the good information and to educate everyone. And I also think, again, similarly, access to healthcare has been improved. I think identification of key symptoms and helping people know and recognise what sort of symptoms require going into hospitals and things like that. I think it's really helped. In terms of questions that are asked, I think social media is a really good thing in terms of if you wanted to search up a question and a query. Sometimes people really enjoy watching videos, they find it more engaging and it's going to stick with them for longer rather than lots of text. So for example, a TikTok, I think it's really helped education and access in general for healthcare. But I think there's also some downsides of that. I think something that I've seen on TikTok myself is things that have been taken out of context. So for example, TikToks, you can stitch and cut TikTok so that they only say one sentence, even though it's been one sentence in a 2-minute video, and that can be to falsely spread misinformation. And also the fact that it's not then regulated. You know, people can cut and chop and do whatever they want with the information. And similarly with that, we can have the kind of lack of regulation on social media. Some people could be pretending to be doctors. There's no way that social media platforms can regulate this, and I think that's become quite an issue of people posing to be doctors and handing out misinformation. But also similarly, understanding people's backgrounds in medicine. For example, again, I'll take the example of COVID times. So someone that's like an obs and gynae doctor doesn't necessarily know everything to do with the production and the mRNA technology within a vaccine. And I think it's really hard for the public to understand and to judge what people's experiences are and whether they have the best and the top information at this. So I think the authority issue can also cause some problems. But in general, I really think social media has helped with, like I said before, education and access to healthcare, particularly in the younger population. But I think in the future, there will need to be some tighter regulations to ensure that it is all the best information that is going out there, rather than the sometimes can be easily spreading of misinformation.
At a time when there is strain on the NHS services, what supportive roles could medical students undertake to help within hospitals?
I think medical students have had a lot of clinical experience that could really help in these times when we are understaffed within the NHS. I think they can cover and help such a wide range of patients' journey into healthcare. I think, for example, when it comes to screening, the medical students could help with bringing patients in and talking them through the different types of screenings that we can do, whether that's blood tests, maybe taking their bloods, which are basic clinical skills that are taught right from the very start of medical school. Also, maybe then when a patient comes into a consultation, they're taught from very early on how to take histories and things like that. And I think that's something that medical students would be able to do, you know, building the rapport with the patients, not necessarily giving all of the direct clinical and more complicated decision makings, but I think they'd be very helpful in offering patients the support. I think it's a really good way as well for medical students to learn those key skills. I think we particularly saw that in the COVID pandemic. I know a lot of medical students volunteered as healthcare assistants, so they were involved in the observations of patients, and it really got them used to that clinical environment. And I also think maybe in terms of like checkups and checking in on medications and seeing how those things are working, and then can refer on to a more senior role if needed to. But I think there are so many different ways in that medical students can help this strain. I think it's something that really should be implemented because it gives them clinical exposure and can also help them learn the skills which they'll need later on when they graduate.
What has been the most important technological advance in the NHS in the last 5 years, and why?
Okay, so for me, I really think kind of the genetic advancements, like the technology that we now have to investigate genetic bases to diseases, has been really important because it's increasing our targeting, it's increasing our healthcare lifespan and making sure that we have the most effective treatments. So in particular for genetic technology, you know, genome sequencing has been incredible in the last couple of years, particularly with the COVID pandemic. Genome sequencing has allowed us to understand all about the different COVID variants, understanding then maybe why symptoms may differ and how maybe the vaccines need to be altered in order to best fit this current variant that is prevalent in the community. I also think kind of the genetic basis to cancer treatments. You know, we now know that cancer is not just this one disease. Can be caused by so many different things, and some of these are genetic basis. And I think us now being able to identify when there's a genetic component to a disease, means we can then have this personalized medicine, which is really key, of targeting these cancers differently depending on their pathophysiology. I think that's something that we're really going to see in the future, is this idea of personalized medicine and treating individuals rather than the diseases as a whole in itself. I think it's really going to improve patients' health.
What is the importance of NHS smoking cessation services?
So, as we know, smoking is a risk factor in many diseases that place a huge burden on the NHS, whether that be cancers, whether that be cardiovascular diseases. So it's really important that as kind of public health campaigns that we really try and encourage people to stop smoking and educating them on the risks with smoking. I think the NHS smoking cessation services are really good. They offer things like one-to-one therapies and group therapies where they can really understand why people want to stop smoking. Maybe if they've tried to quit before, why it might not have worked, and really offer support groups to help people talk to others in that similar situation and kind of build up that motivation. I think something that I've read about, which is really interesting, is encouraging people in these groups to measure their carbon monoxide levels when they come in for those support groups, and so that they can see their progress across time, to really help encourage and motivate them and see, you stopping smoking really has had such a benefit to your body. And I think that's a really good way, but also understand that that might not work for all. And things like nicotine patches are something that's really key to helping some people stop smoking. And I think overall it's a really incredible service. I think it's been a very successful public health campaign over the last 10 to 15 years in particular. The smoking rates have really dropped, and that is making sure that there's less pressures on the NHS, because a lot of these diseases like cardiovascular diseases and cancers are really associated with high cost, but also improving the UK's health. So really overall I think it's a great service.
In what ways has the NHS contributed to improving sexual health?
I think sexual health is something that's really important to encourage good sexual health and well-being. I think one of the first instances that the NHS have really encouraged is education. For me, myself, when I was in school, there was kind of the local healthcare centre that came in and gave us an assembly talking about the risks of STIs, contraception, and all the things like that, and help educate us on where we can get access to these things, and kind of destigmatizing the whole idea of sexual health from quite a young age in schools, I think has really helped. So education wise, and then I also think access wise, the NHS has many different locations and kind of levels of healthcare that can offer sexual health support, whether that be your GPs in a regular consultation, whether that be at a specialised sexual health clinic where they can offer more in-depth advice on the different contraception methods and things like that, and also pharmacies. So I think by improving all of this access means that individuals can go to where they feel most comfortable, where's most easily accessible and most appropriate for them. So it's kind of casting a wide net. I also think the encouragement and education around screening for sexual health. So there's also kind of the discreet nature now of postal kits and things that we can register for online, which I think has really helped because, again, like I said, sexual health is still quite stigmatized, and doing things in the private and confidential of your own house has been really good kind of important progression that NHS has made. But also as well in terms of treatment, I think now there's been more education around how easy it is to treat some of the sexually transmitted infections, and or again, like I said before, the different ways and different practitioners that can offer treatment. I think it's been a really good positive from the NHS.
What pressures do poor living conditions and homelessness add to the NHS?
I think, as we know, health is inextricably linked to our environment, and poor living conditions and homelessness is definitely something that's gonna impact on our health. I think if we start looking at risk factors that are associated with these two situations, the cold is a big one. The cold, as we know, is a risk factor. Hypothermia, it can be linked to cardiovascular complications, can be linked to respiratory conditions. I think one that's been really prominent in the news at the moment is mold and damp within houses. It can really cause a lot of healthcare problems because of allergens, or sometimes it can release toxins. And AWAB's law, I think I've read about, is unfortunately a young child died due to really poor housing conditions that was associated with mold, and it's to really encourage councils to have stricter regulations when it comes to housing and in safety, to ensure that people can live in a healthy environment. And then so I think when we talk about kind of treatment itself, for those who are homeless, often I think they feel like there's barriers to healthcare. They struggle because they might not necessarily have a permanent address, that when it comes to things like registering for GPs or giving contact details when you're walking into A&E and things like that, to allow communication between yourself and the healthcare system, it's really a barrier, meaning that people are not getting treated when they should be. I think also another important one is when it comes to discharge. In these poor living conditions and people that are homeless, then home environment is not really safe for them to be discharged into. So whilst they've been doing a really good recovery in hospital, as soon as they come back to their outside environment, which is associated with these risk factors, it means that their conditions are going to exacerbate. Maybe they can't store the medications how they properly should be stored, or again, they don't have access to the pharmacies and things like that to get their repeat prescriptions and things like that if necessary. And so I think overall, the people who are living in poor living conditions and those who are homeless really face big barriers to live in a healthy life. And I think it's really important that councils and charities really try and advocate for these people to ensure that they have the same access and the same right to healthy living and to healthcare just as much as everyone else.
What are the arguments for and against reducing the 2-week cancer wait pathway to 1 week?
As we know with cancer, the earlier we treat it, the better the prognosis often is. And also we know cancer, it can be an incredibly stressful time. When you go to a GP appointment and they maybe suspect cancer and you're placed on this urgent referral list, it can be an incredibly stressful time for individuals. And so we really want to kind of have them have their tests and results as quickly as possible. So of course we would want to reduce that wait time down from 2 weeks to 1 week. But kind of taking into consideration the nature of the NHS in terms of its cost and capacity, the fast track nature of 1 week would exert a lot more costs onto the NHS. And also we don't necessarily have the capacity or the resources to do that, because whilst cancer is very, very important, there are also other areas of the hospital which will need these sorts of things like scans and blood tests, such as those that are coming in from A&E that are needing urgent, say, MRI scans and things like that. So I think it's a balance between cost effectiveness and ensuring that patients are given the best and most efficient healthcare that they possibly can. So I think it's definitely something to aim towards, having the wait time reduced from 2 weeks to 1 week. But I think we also need to appreciate that given the cost of living crisis and all of the issues that the NHS are currently facing in terms of staffing issues and things like that, that it might just be a little bit out of reach at the moment.
Have a read through of this article. What are the barriers to children accessing mental health services?
Okay, so I think there are a lot of kind of barriers surrounding children accessing mental health services. I think to start off with, education. I think it's improved a lot over the last couple of years in terms of education in schools, but still I think there is kind of a stigma around mental health, and that when you can experience it, who can experience it, any of us can experience it. And I think there's a really important job to be done in schools to educate people on signs of people who are suffering with mental health conditions, and encouraging people to reach out to their friends, reach out to their teachers, or if necessary to reach out to those healthcare providers. And so I think coming with education is also access to these, making sure that children understand that they can have access to this via anonymous phone lines that are there for support, whether that's GPs, but also as well, school is so intertwined with children's mental health and kind of encouraging them and making sure that they have access to people to talk to if necessary. So I think that's really important as well. And then so in terms of treatment, I think, we have the different forms of treatment, whether that's things like talking therapies such as cognitive behavioural therapies for certain things like anxieties, and then pharmacological agents if needed. And I think it's around education again on the different types of treatment that can be given to children, to really encourage them to reach out and to know that there is help for them when they require it. And I think just in general, there is a really big mental health crisis among children in the UK currently, not even necessarily the UK, across the world. There are thousands, like it references in the article, thousands of children that are experiencing mental health difficulties. And I think access, education to treatment is really important, because if we don't treat them as children, it's going to have long-lasting impacts on their life, whether that be disruption to education, which means they can't reach their full potential, if that means struggling with relationships, whether that be friends, whether that be family, and all of these are just going to exacerbate their condition if they're not given the treatment they deserve. And so I think destigmatizing mental health and reaching out in children is definitely something that we should improve. And I think schools play a big part in that, and the NHS, and linking those kind of two environments together is something that we should really try and implicate in the future.